Today's topic is public health and vaccines. Hello, everybody. Good to be with you once again. Today we have with us Dr. Raj Shankar Ghosh, an actual physician who has been working on public health and vaccines. Let's hear from him. Over to you, sir.
Thank you. Thank you, Mr. Mathur. So, hello, everyone. I am Raj Shankar Ghosh. I'm a physician. For over the last 3 decades, I've been working on primary healthcare, vaccines, infectious diseases, and health systems. So what I thought is that I will talk to you a little bit about the vaccination journey that India has taken over the past 3 decades that I have been engaged in the program in the Indian health system. So India today is one of the leaders in vaccine development, which means vaccine manufacturing and vaccine delivery in the world. When I talk about vaccine development, India has today superpower vaccine manufacturing companies, many of which, are known to the public, and therefore I'll not go with the names. But what I can say is that for all the low and middle income countries in the world, almost 65 to 70% of the vaccine is supplied from India.
Well, that's something to be proud of.
Absolutely, absolutely. And secondly, in terms of vaccine delivery, we know that during the COVID vaccination period, India delivered more than 2 billion doses of the vaccine across the country. The issue that we are now dealing with is around the coverage of vaccines, which means that in the country, in our routine immunization program, we have more than 80% coverage. But then there are certain pockets which are still left out. There are individuals within a population who are left out. And the whole goal is around working on quality vaccine delivery, ensuring that we have an equitable distribution of the vaccine. And the most important thing is that the program will include every individual who is eligible for vaccines. Now, how do we do that? Let me say that in today's world, there are 3 T's which are very, very important. The first T is trust. There must be a trust between the population and the health system, for which the population will accept what the health system will provide to them in terms of public health goods like vaccines. Let me tell you a small anecdote.
Yeah, please.
In 2001, I was a medical officer in World Health Organization looking after the polio eradication program. And we used to go and investigate cases of polio across India and take the necessary steps. One day in the afternoon, I had just finished my lunch. I was sitting in my office. I received a phone call from Kishanganj district that there was a case of suspected polio, which I had to come and investigate. I used to then stay in Siliguri, which is about 2.5 hours drive from Kishanganj. So I started because this was an emergency. I started and reached the village sometimes around the early evening. The sun was just setting. So I went to the house. The house was filled with people. They were all waiting for me to come. I came. I investigated. A small child. The child was lying on the lap of the mother. I investigated the child. There was a paralysis on the left lower limb, which is the left leg. And on first sight in clinical examination, the child did look like the child had polio. The usual protocol was that we had to collect stool samples. So I gave the containers, I asked them to collect samples, and those samples would be sent to the laboratory, and all of that happened. I told them that this is what needs to be done. And then, when I was leaving the house, the grandmother asked me in front of all the villagers, the doctor saab, please tell me whether my grandson has polio or not. So I said that, I cannot tell you whether he has polio because I can only tell that once I have the sample results. And before that, I'll not be able to tell anything. But the grandmother insisted, and she kind of blocked the door and said that, doctor, you have seen many cases. And because you have seen so many cases, you should be able to tell whether my son has polio, a grandson has polio or not. And I said that, no, I will not be able to tell. And this was going on for some time. When suddenly the mother of the child, who had not spoken a single word till then, told me that, doctor, in pure Hindi, told me that, doctor, you go home. You don't need to worry about my son. My son does not have polio. You rest assured. And with that, the crowd thinned, and I went out of the room. I sat in my vehicle and I started my return journey. So while I was returning, I felt bad for the mother because my clinical acumen and clinical judgment told me that this was a case of polio. I had seen many cases of polio. And I was just thinking that when the results come, what will I go and tell the mother, who was so definite that the child did not have polio? So I went to the office, the samples came, we sent it to the laboratory, and after 10 days, I received a call from the laboratory in Kolkata. I was sitting in the office, and exactly I had finished my lunch, the call came. And, then a fax came, and voila, the child did not have polio. I was very happy. I went out and I bought a packet of sweets, and I started the journey back to Kishanganj. I reached the village, and then more or less the same time, the sun was setting and all of that. So when I got down from the car, I had a box of sweets in my hand. So the grandmother was there. So she kind of smiled at me. She understood that, there was good news. All the villagers came. There was the same scenario. I entered the room. I gave the box of sweets to the mother. The child was actually crawling by then, much better. So I gave the sweet, and then she smiled at me and said that, thank you, shukriya. And I then asked the mother, actually, I had thought your son might have polio. How were you so sure and definitive that your son does not have polio? Then she smiled at me and told me that, doctor, I thought you would know that. Every time the health worker has come, I have vaccinated my child. And the health worker has said that if I vaccinate my child cannot have polio. Therefore, it is common sense that my child will not have polio. And I thought that this is trust.
Trust. This is
the
trust.
Trust that the mother had on vaccines, that if the child has vaccine, then the child will not have polio, is the kind of trust that community has on vaccines.
Yes.
In a very recent kind of survey that UNICEF had done, in India, 96.5% people believed that vaccines are good.
Yeah.
This has only been done because of the health workers who have been able to convince the population. So that's the first thing. We must continue to tell the truth, tell it transparently to the population so that they continue to trust our programs and they have confidence on us. The second T is, in today's world, technology.
Mm-hmm.
In the forward-moving world, technology will be a driver. We have seen during COVID times how COVID has played a major role. There are various other technologies that the immunization program kind of puts in place. There is something called Electronic Vaccine Intelligence Network, by virtue of which anybody sitting in Delhi in the immunization department in the government of India will be able to determine what is the status and the stock of the vaccine in a very remote cold chain point across India.
Yeah, wonderful.
The third, yes. And the third is that, India is launching a program called UWIN, by which we'll be able to record every vaccination across the country digitally. We'll be able to deliver certificates digitally. Therefore, we must ensure that we have technology that will be user-friendly, technology that is safe, and that kind of accelerates the program. The final T
But
is about teamwork.
Doctor,
Yes,
before you
sorry.
go there, let me
Mhm.
say that I'm much more interested in this digitalization than in the digitalization of payments. That is a bloody, that is a convenience, for a few
I know.
people and even maybe
I
for
know.
more. But this is actually reaching the masses. This
Absolutely.
digitalization is actually helping those who need the help rather than simply saying, oh, I can show my phone and make the payment. Okay, wonderful. You save 10 seconds. This will save lives. I'm
I
really
know.
impressed by this effort. People ask me, what do you think digitalization is doing for the economy? I say, doing what? It's just convenience. But this is reality that you have the
Yes,
database. You are able to
exactly.
correlate things and seek out answers and solutions. And also, I'm really impressed by this digitalization. And I'm glad you told me this because nobody talks about this. Only they talk about, UPI, RuPay, I can pay with this, I can pay with that. I said, bloody hell, it's the same stuff you are
You
buying.
are an economist. Absolutely. You understand. Yes.
Yeah, it's just the same things you are buying for the same price. You're just paying you don't give the paper or the coin, you give a phone, okay, fine. It doesn't create a job, it doesn't help anybody. It's convenience, but this is reality that you are reaching out. And, in case there is any issue that needs to be addressed, then you have the information. So I'm really
Exactly.
very, very pleased to hear it. So thank you very much but sorry for the interruption, but I had
No,
to.
no, no, absolutely perfect.
Let's go to
This
the third
insight is
T.
very, very helpful.
Let's go to
The
the third.
third T, yes, the third T is about the teamwork. This massive program that is done is not possible to be done by one single agency. It has to be a teamwork. Now, what do we mean by teamwork here? The teamwork is actually between the vaccine supplier, the agency, which is the government, which has the mandate to supply the vaccine, the private sector, but most importantly, the community. The entire partnership, which includes the developer, the agencies, the public, the community, all of them must come together in order to make it successful. If the developer does not develop the vaccine in time, then we won't have the program. If the vaccine is not delivered in time by the agencies, we won't have it. If the community does not accept the vaccine, then we will not have a good vaccination program. This partnership, this ecosystem is critical for things to move forward. Therefore, trust, technology, and teamwork are the ways for us to really move forward. Next, I really want to talk a little bit about our forward moving journey.
Okay.
There are two things which are very important in the vaccination program. One is that two things which matter. One, that every life matters because it's not about those who can afford or those who can access. It's about everyone having the opportunity to get a public health good like a vaccine, a
Yeah.
drug, or a diagnostic. So every life matters. And the second is about the scale. It's not about some small demonstration that will happen, which we can, celebrate. We have to celebrate the scale of the program that is there. The third, obviously, we talked about technology, which is very, very important. The fourth thing, is very important for us to move forward, which is about the demand generation. That, ultimately it needs to be such a sustainable program in which the community keeps on demanding about these services and holds the government accountable, either during the, electoral process or during any interactions that they have, that there is a demand for the vaccine, which means that it has to go a step beyond equity. we have to be inclusive. This came up because when we were celebrating our COVID vaccination coverage, the 2 billion plus, there were pockets where we worked, where the transgender population, people living with disabilities, the population which lived in very remote areas, and I have traveled to some of them in Meghalaya, East Khasi Hills, in Palghar region of Maharashtra, very deep, 37, 40 kilometers away from the last hospital, their populations were being missed. So unless we are able to include everyone, then we will not be able to take it forward. Therefore, after COVID, what we have now started is at the Indian Institute of Technology in Delhi, at the Department of Management Studies, we have started a platform which is called the QEI platform, Quality, Equity, Inclusiveness Platform, through which we will celebrate the inclusiveness and the quality of services that are being provided across vaccines, drugs, diagnostics, any primary healthcare activity. Because the government has a mandate for coverage and the government will celebrate coverage. We need to push the government to say that coverage is not enough. The 90% figure is not enough.
Yeah.
The 10% who are left out also matter.
Yes.
That's what we are trying to do.
Absolutely. You want, you cannot leave anybody out. It's absolutely clear.
Yes.
Yes.
Yes, absolutely. Yes, so, this is what, I had to tell you about the journey that India has had in its immunization program. And, that we will be moving forward with all of these principles in place. And we hope that, India will continue its journey on vaccination, and from vaccination, other programs that will move forward.
Okay, so could you perhaps talk about some of the key barriers that have been removed in recent years?
Right. So if we look at what are the barriers in immunization, then we should look at, or not only in immunization, broadly in public health care, we call it about the I factors. The I factor stands for, one is that there are multiple vertical programs happening. There is a program on immunization, there is a program on nutrition, there is a program on tuberculosis, there is a program on reproductive health. These need to be integrated because the point of service delivery is one, which is the health and wellness center from which this is delivered.
Yeah.
It is being delivered by one person, who is the health worker. Therefore, we need to integrate all of this. So the first I stands for integration. The second is that we need to have a continuous impact assessment, which means that we need to continuously understand what is working and what is not working. And thereby, comes the third I, which is the investment. Where do we make the investment? Because we have so many priorities. Yeah. India or any other low and middle income country have too many priorities. Yeah. Where do we invest? That we will understand by impact assessment. And the next is that, which is very, very important, is institutionalization, that we need to ultimately ensure that there are institutes which will be able to drive it. It may not be a brick and mortar institute. It might be an institution which is the government institution, a private sector institution, a non-governmental institution. All these institutions must come together in order to develop a collaborative factor to drive forward. Three things that have, as what you rightly talked about, that what are some of the challenges? We say that there are three A challenges. Okay. The first A is around awareness, that many people are not aware of the services that are available. So we need to ensure that we are able to take the message to every person to make them aware of the facilities that are available. The second is apprehension, that people are afraid of some of the things that are coming around the COVID vaccine, or around technology, or around drugs, or around, various kinds of programs that are there. This apprehension comes primarily from lack of awareness. So if we are able to solve the awareness problem, much of the apprehension is also solved. And the third is around access, which means that, we are not able to reach everywhere. Some of the areas are so remote. Therefore, we will have to find mechanisms in order to overcome that.
Yeah.
starting from, what we did during COVID, drones, to, working with community-based organizations, with some tools that we use. For example, there is a tool called Vaccine on Wheels, where, uh, the vaccine and the people who will deliver and a medical officer, they are put in a van, they go to remote villages, they do a vaccination camp, they come back. So various kinds of things are being worked around. So three barriers: the awareness, which can be addressed by technology heavily. The second is around apprehension, which can be addressed if we address the awareness issue. And the third is access.
Okay. All right. Thank you so much. Let me ask you a question which
Yes.
I, as an economist, struggled with in rural Africa. And that is, how do you maintain the cold chain?
Yes. Great question, actually. So, in terms of vaccine cold chain, there is a very important issue that needs to be kept in mind. That it's not about, it's not like a beer or an ice cream, which if it gets warm, it can again be frozen. Once the cold chain is broken in a vaccine, it is gone. So vaccines, the cold chain issue has been solved by technology, which is called the vaccine vial monitor. So every vaccine on it has a label in which there is a square and a circle. By the color matching between the circle and the square, we understand whether the cold chain has been maintained or not. It's called the vaccine vial monitor. How do we manage it? Every vaccine, more or less, which are used in the universal routine immunization program, are maintained between 2 to 8 degrees centigrade. And when they are carried out in the field, they are taken in cold boxes, which we call the vaccine carriers. And they have the ice packs. And these are taken, the vaccination program is carried out, and they are brought back to the center. At every point, the vaccine vial monitor is checked by the health worker, and also the public can check it because they also understand whether there's a color difference. And based on that, we ensure whether the vaccine can be used or cannot be.
Okay. No, we had to install, in the rural health clinics, there was no electricity. So we installed solar panels with a WHO designed solar fridge. And that was the only, because, as you said, they are taken out. But then in the place where they are kept, if you don't have power supply, then it's not.
Absolutely.
You're breaking the cold chain right there. So we had Uganda, for example, now all the remote health clinics, and I've been there, they are hardly people call them health clinics. They are one small room, really. But the women give birth at night without light. So they need the solar system to have light and vaccine fridge.
Right.
But India, I guess, is more advanced than that. You probably.
So, yes. Right. So there are three things that are, happening in terms of moving forward technology. One is obviously solar energy technology, which is also in terms of the clean energy that people want to really promote. The issue with it is that, the maintenance is an issue in remote areas. In Northeast, some of them had been planted. I'll not say that they have been super successful because maintenance has been an issue. The second thing that is there is that we are trying to develop globally the cold chain free vaccines, which means that vaccines which will no more require cold chain.
Right.
Technology can solve that problem. And then there are other kinds of things that are happening, which are, for example, called patch, which means that instead of injection, we have just patches which you put on the skin and the vaccine gets absorbed. So all of these are being tried, but it is an essential problem. Cold chain is an essential problem. And, in COVID times and other times, we were able to vaccinate across the country. So cold chain infrastructure in India today is good. The bigger challenge is around the use of syringes. That supply and everything really has to be maintained.
Okay. I think it's a very helpful and informative talk from you. Is there anything else you'd like to add?
No, I think I'm good. This was a wonderful opportunity. I really wanted to thank you for this conversation. And
okay, so let's say bye to the viewers, and I think maybe I'll catch up with you 1 year from now to see what progress you can report on the issues that you have talked about. And
Absolutely.
so let's end the talk here. Let me say to the viewers, I'll be back with another expert or another young Indian, and bye till then. Okay, so let's talk. Bye-bye.